Clinical governance is for organisations to follow and ensure they are continuously improving the quality of their services, safeguarding patients to a high standard of care. This is done through the following 7 pillars: clinical and effectiveness and research, audit, risk management, education and training, patient focus and public involvement, using information in IT, staffing and staff management. We will be explaining risk management and giving an example of how we can be involved in the future. In healthcare, risk management is defined as the systematic identification, assessment and evaluation of risk. When used properly in healthcare, it can not only process to report incidents, but also minimise the harm that clinical and resourcing errors can cause patients. Within all services, accidents and errors can happen, from minor to serious incidents, all of which should be learned from to avoid and manage for future incidents effectively. Risk management involves identification of risks, risk assessment, risk reduction, elimination, transfer, reporting and recording adverse effects. Usually within dental practices, there may be someone employed out with the practice to advise on compliance with safety, for example, a radio protection advisor for advice on IRR. Or within the practice, an employed senior member of staff such as a manager, senior dental officer or lead dental nurse, identifying the risks within the workplace, carries out risk assessments and creates policies and contingency plans to implement to reduce the likelihood of an occurrence. Identification of risks. In healthcare, there are many dangers that could potentially be at risk for both staff and patients. People may think that risks such as infection control or COSH, however, there are many risks within the dental environment. The STSTEP guidance provides us with practice support manual, which identifies possible risks within the dental setting. They are broken down into the following: clinical, failure to diagnose instrument trauma such as burn, administration, system, power of equipment failure, financial debt or environmental, as well as vicarious, so that's poor communication and inadequate training. Risk management is part of our clinical governance to identify and minimise risk within the dental setting. It is possible to miss a risk within the workplace. Therefore, it's important for us to discuss with our teams so that risk can be identified and can be brought to our attention. Risk management involves identifying risk areas such as clinical, environmental and systems, deciding on who it may harm and how, evaluating the risk on deciding precautions, record and finding the risk to take appropriate actions, review your assessment and update necessary, share all findings or changes with staff. Managing risks is applicable to every workplace and can differ with potential risks that could occur. The government website has provided the management of safety incidents and national screening programmes guidance, which are requirements for management safety concerns, incidents and serious incidents in the NHS programmes. It should complement local risk factors as well as management strategies and processes. Risk reduction, elimination and transfer. An example of a risk reduction is carrying out endodontic treatments on a patient. There is a potential of patient inhaling or swallowing sharp files, therefore rubber dams should be used in place to prevent the likelihood. Additionally, there is a potential sharps injury to the clinician, so clinicians should appropriately handle these instruments and disregard instruments as per manufacturer's instructions, e.g. the sharps bin. Practice can implement policies and procedures detailing of all aspects in the practice activity that are carried out to reduce the likelihood of adverse events. Some policies within dental practice include infection control, radiation protection, COSH, healthcare and safety, data protection and confidentiality. All staff should be shown these policies and procedures with a signed record from all employees of reading. To ensure compliance audits are carried out, if any changes of the policies are made, all staff should be made aware. Secondly, risk reduction measures should include regular training of staff, continual professional development. CPD is a GDC essential requirement for all dental care professionals, following ensuring that they are within their professional skills and updating their knowledge up to date. Reporting and recording adverse effects. It's important to promote a blame-free culture to encourage anyone to report any potential risks. and near misses and admit when things go wrong. This aids in improvement and learning and ensures that these incidents don't occur again. Within the practice, reporting may include recording in critical incident forms, the accident books and complaint records. As a professional duty of candour, we have a duty to be open and honest and transparent with patients if something goes wrong and within their treatment of care that has potential to cause harm. Additionally, if there are concerns with patient safety, malpractice or regulatory breaches from fellow staff members, we have a duty to whistleblow and raise concern as per GDC Standard 8. Our role in the future. So as a dental therapist, we have a variety of roles